everybody! It's President's Day in the United States, and today we're going to talk about a single choice, one choice you can make to optimize your body health. way easier said than done. And today we're going to start with a little optimism and a little bit of friendly canine love. I want to introduce you to Marcus Barkus Aurelius. Marcus, come here. Yes. You're going to meet him. Okay. Up. Marcus, up. Come on up. Yes. There he is, folks. This is Marcus Barkus. Hello. Welcome as everybody's coming in. Can you hear me? Can you see me? Margaret, hello. It's lovely to see you. I know that I still owe you an email. I'm so embarrassed by that. Welcome, everybody. Who else is here besides me, Margaret, Marcus Barkus, the Aurelius champion dog? Hi, Margaret. Who else is here? Tell me, where are you chiming in from? Margaret, I'm trying to remember. I think you're Scotland. I could be wrong on that. Who else is here and where are you chiming in from? Marcus, come on up. Come on. One more time. Say hi. Up. Come on up. We're working on a new trick. Marcus, up. Up. Come on up. There he is. There he is. Oh, there's Mr. Marcus. He's got a new bandana on for Valentine's Day, even though that's over. And it says, I woof you. And it's very cute. Margaret, it is on my list. I had to actually update some of the website stuff before I could give you the new updated version. So that's why the delay. Not because I'm a slacker and I forgot, but sometimes that's true. Okay, we've got Margaret here from Scotland. We've got people coming in. Tell me, who are you and where are you coming from? I really love the engagement with people. Community, connection, we are wired for that. There's been so much hardship around that over the last few years. And from my experience, so many of our nervous systems have gotten like deconditioned for being around other people. And so view this as an opportunity to practice your conditioning, right? Your weight training for social engagement. So please engage with me. Tell me, where are you coming from? Where in the world are you tuning in and chiming in from? And I particularly would love to hear from you today because I'm going to be talking about choice. A single choice that I think, based on my pattern recognition over 20 years of what drives health in the body, which affects the mind, and what drives dis-ease in the body and the mind. So, y'all are crickets today, man. Give me something. Know that I want to talk with you, whoever you are and wherever you're at. And if you don't, that's okay too. I will just talk to a camera because I'm getting better and better at that over the last 3 years. That is for sure. So my name is Dr. Renee Ostertag. I am a physical therapist and psychotherapist here in the state of Colorado in the United States. Jen B, welcome. Thank you. Thank you. Oh, you lucky lady. Vacationing in Hawaii and listening in. My goodness, I hope you can just soak up the serenity of the waves. There's something about the reciprocity of water coming in and out. It's very soothing and very rhythmical. Just dreaming about Hawaii right now, and Jen's there. I'm imagining she's on a beach, although it's early in the morning there. Isn't it like 6:30 maybe? It's 10:30 here in Denver. Hi, Margaret. Excuse me. Okay, my name, Renee Ostertag, licensed physical therapist and unlicensed psychotherapist, which I love because I have this really good combination of mental and physical health and where they intersect. And I help people become nervous system ninjas, right? Like at the intersection of physical and mental health, our nervous system orchestrates both of those things. And we can learn to develop skills to better regulate them. That being said, this is not medical advice. This is strictly educational in nature. This is my disclaimer to you. So, if you are struggling with a mental, physical health challenge of any kind, please reach out and get the support that you need and deserve. And we'll continue on to the education here. That being said, because I am a licensed provider, I can provide medical advice, and you would need to sign up for a free consult with me to make that happen. And I would really enjoy that. So, today we are going to be exploring one single choice. If you make this choice long term, your outcomes will be better, no matter what the challenge is with your body, which affects your mind. One of the things that I have struggled with over the years is this like expectation and pressure that I put on myself. Society puts it on all medical providers, patients put it on all medical providers, and it's nobody's fault. It's just like, I'm scared. I don't know what's happening. You, expert, I need you to have an answer for me in this unknown, scary thing. So it puts pressure. And I think with bodies, they follow reason that reason doesn't reason. And so oftentimes there isn't necessarily a clean, concise answer when we're having a problem, which is challenging for everybody. And so the best thing I think in the face of that is to develop pattern recognition. And so I've discovered this pattern over the years with people that are struggling with some sort of persistent issue, honestly, in mind or body, anxiety, depression, physical pain, some other diagnoses. I see people struggle because they're in their pain point and they don't want to be in their pain point, and they're physiologically pitched into this position of oftentimes very powerless, helpless, frustrated, don't know what to do, don't know where to go, scrambling around for answers. And they end up in this unfortunate place of like, I hate my body, I hate what's happening, and I want to reject it. Like it makes me so um I get really caught feeling sad and struggle with hearing the number of people I have heard over the years say, I want a total body replacement. Just cut my leg off. I just want to get a new back. Can you relate to that challenge? That is not a character flaw. That's an unfortunate position that we all get put into sometimes. And I'm wondering if you can relate. Have you ever gotten to the place where you could just get rid of something in your body because it's in pain, it's suffering, you can't find the answers? Is this a challenge that you know? Maybe it's your mind. You have a problem and you can't get rid of it and you want to get rid of it. Man, I think I'm talking to an audience of about 50,000 crickets today. It's fantastic. I love crickets, so we're in good company. Sorry if my drinking noise bothers anybody with sound hypersensitivity. That's a real thing. So, pattern recognition. People get stuck in this place of wanting to reject their body. And yet, if you're going to choose to continue to live, you're in a tough position because you can't reject your body as much as you might want to cut off your leg. You're probably not going to because you need it. Period. End of sentence. So this all came up because last week, I had a couple conversations with people. And I feel resistance talking about this because it is challenging. It is hard. When you are in the position that I'm talking about, it's hard. It's hard for you and it's hard for me as a healthcare provider. And you know what? Life includes hard things, and we can collapse in the face of it or rise up and learn from it. Oh my gosh. Oh, wanna make way. I won't sing anymore. I'm so sorry. I just saw Fairly Fecale pop up. Owana, you are traveling in North Wales and hope to be able to catch this one. Well, you're here, you're with me, you're live. I love it. I have people in Hawaii and Scotland and Wales. Who else is here? Let me know. I love connecting with all of whoever's here. And it just helps me know where you're at in the world and who I'm talking to, besides the crickets in my camera. So, we're talking about the single choice you need to make. Oh, Jen. Oh, Jen. I wanted to do a total mastectomy for my breast cancer. I realized that was a fear response and then chose the least invasive treatment. Jen, I have goosebumps. How did you realize that was a fear response? And you're making me so clear on the people that are stuck in that place of wanting to do the extreme. Like, I want a total body replacement. That's just a reflection of being in extreme pain and or extreme fear. And the roots create the fruits. When we make choices from threat and fear, we tend to get more threat and fear. And that's totally natural and understandable. Not a character flaw. I'm having this conversation to promote awareness of choices beyond fear. When people are wanting to reject their body and what's happening, as Jen's saying, they're in a fear cycle between mind and body. And they're making a choice and they don't know they're making a choice because they're caught up in a feedback loop between mind and body. And Jen realized she was locked up in a panic pattern. How? Like, how? I don't know. Sometimes humans amaze me. Like, how do you know the things that you know? Well, oftentimes it's because we take a pause, right? Like, pause, clarify, decide, right? Like, slow down half a second, half a tick, half a notch, and just sometimes grace pops in, wisdom pops in. I don't know how Jen realized she was in a panic pattern, but I'm guessing something happened in her because she slowed down a little bit. Maybe somebody outside of her helped her slow down. That's oftentimes what my job is slow down a little bit so that you can kind of take a look at this situation that you're in from a place besides just locked up panic and fear that has you saying, I want to cut my body part off or get a total body replacement. So we need some space between stimulus and response. We need each other to help us realize we're stuck in a pattern of fear. And then once we realize we're stuck in that pattern of fear, we can make a new choice. And so peace, oh, I love that sentence. Jen says peace truly informs truth. I'm letting that land because I've spent so many years as like a person who needs control because I didn't have control. I didn't have control inside my own skin encased body. And that's really common. When we feel out of control inside, we try to control outside. And then people call us control freaks. We just need a sense of control. That's all right. There's nothing wrong with you for needing a sense of control. I think you suffer more. I suffer more when I'm trying to control things that are ultimately outside of my locus of control. And I came across this quote that was just gorgeous. And it said, you need peace more than you need control. And it's true. When I have peace with the unknown, with uncertainty, I can breathe easier because life is so much uncertain and unknown. And when we have peace, it can inform us because there's more space to see truth and then make choices from there. And so that's the choice, I think, to make. And this is the single choice here. I think we can choose to accept something. I think we can choose to reject something, or I think we can choose to tolerate something. And I want to say more about all those three things. I'd love to hear from anybody that's here. What's been your experience with body suffering and the choices that you made, and what were the outcomes? So, a big part of being in medicine or dealing with a body health challenge, a mental health challenge, is what do I do in the unknown and how do I find peace there? Because that's the last thing I have right now. So, how do I find peace in a circumstance that's challenging and typically drives fear as opposed to peace? So, pattern recognition is really helpful. And there's this way that I'm trained in physical therapy called McKenzie therapy. So, mechanical diagnosis and treatment. And when we're trying to figure out a problem or find a solution to the problem, we lean into pattern recognition. What movements increase pain? What movements decrease pain? What positions? What postures? Right? So, we're looking for a pattern of what makes pain go up and what makes pain go down. And then we want to help the person learn to do more of what makes pain go down and less of what makes pain go up. This is very easy to say. It's not always easy to do. And it can be tricky because pain, especially, I think all types of pain, it doesn't follow logical rules. And it's really hard to understand it when you're stuck in a cycle of fear. So there's two time points that are important to pay attention to. What's happening in the moment of a movement and what's happening after. So I'm going to take this pattern recognition concept and apply it to the choice that you get to make: accept, reject, or tolerate. For example, many people have back pain, and what feels good in the moment is to bend forward because that stretches muscles and relieves pressure on the tissue. But that bending forward in the movement is a short-term solution creating a long-term problem. When we do a mechanical assessment on that type of situation, we find that during the forward bend, they're better, but after they're worse. And then if you have them bend backwards the way that they don't want to bend, during the backwards bend, it feels bad, but after they feel better. And I think that's relevant here when it comes to making your choice. Do I accept, reject, or tolerate? Oh, swing eighth. What about thoughts and emotions that cause pain? This is really good question, and I'm going to come back to that in a moment because they do. And it's all 1,000% based on your perception, conscious or not. Are those thoughts and emotions safe, or are they perceived as a threat or danger? And that might be conscious, that might be subconscious. But if thoughts and emotions are perceived as a threat, it turns pain up. If thoughts and emotions are perceived as safe, it won't turn pain up and it can turn pain down. And that's tricky. Like thoughts and emotions, my God, we're having how many tens of thousands of thoughts a day? 50, 80,000, something like that. It's detective work. And that's why it's important to look at pattern recognition, right? Thoughts and emotions that cause pain. What's the pattern? Does that thought drive my pain up or down? Does that emotion drive my pain up or down? And it can change moment to moment. And context is everything. Circumstances around it are everything. So I think it's important to stay curious, not furious, over a period of time and look for that pattern recognition. So let's say swing eighth, you're in a situation where you have physical pain or not. Maybe you have emotional pain. And you know that thoughts and emotions are affecting this pain. God, this is so challenging for me to talk about. You can stay in the loop that you're in, which sucks, or you can make a choice, which is also going to suck. It's just going to suck for a little while because I think anytime we put a flag in the ground to make a choice, it's going to feel hard, but that doesn't always have to be bad. Like, yes, this is hard, but it's a challenge that I'm willing to take on because it sucks right now, but after it's going to be better. And that's the whole thing with back pain, right? And that pattern recognition of like, sometimes we have to do the thing that doesn't feel good now so that we can feel better later, right? Like, I have back pain. It feels good to bend forward. I don't want to bend backwards, but bending backwards is what's going to make me better. Swing eighth, thoughts about all that I just said. Your choice. Do you want to accept what's happening? Do you want to reject what's happening? Or do you want to tolerate? And let's break those down. When people choose to accept what is happening, I think that's incredibly difficult because what's happening probably includes stuff you don't want to be experiencing. And when you say, I'm going to accept this, that's not pleasant for many, many people. That's uncomfortable. It's like saying, okay, I'm okay with this, even though I'm not okay with it. And I don't think that's the case. I think what it is that you're saying, okay, this is what is here. Hello, Angry Peach. It's great to see you. I think it's so hard, but also a challenge worth taking to say, I accept what's here. Now, what can I do with it? Versus, I'm not going to accept what's here because I don't like it. What you resist persists. So when we don't accept what's happening, we're inadvertently causing ourselves more suffering. So, what I'm saying is to accept, reject, or tolerate. When you accept, oftentimes in the moment of choosing to accept, it can feel very unpleasant, but it will lead to better results later. If you can wrap your head around, I'm accepting that this is here. It's terrible. It's awful. It's not fun. It's not what I want. I don't like it. And it's what's here, and what can I do about it? How can I lean into a viewpoint of optimism and say, this is going to be okay eventually? I'll figure it out. This is a challenge that I'm willing to take on because it'll allow me to solve a problem and then feel better later. Confidence in your coping skills is helpful. Having an optimistic viewpoint is helpful. But when we don't accept long term because I don't want to say that this is okay, we prolong our suffering. Is this making sense? It always makes sense in my head, but then I totally don't know about how I'm communicating it out loud. I can accept what's happening, right? Because I historically have such a challenge with high achieving and perfectionism, and I want to get it all right because I want to reduce your suffering. Ultimately, that's not for me to do. All I can do is reduce my own suffering and share with you things that I think work. So I think if you're going to accept what's happening in your body, thank you, Jen, for that feedback. If you're going to accept what's happening in your body, it's important to be clear that that will probably suck for a little while. It's uncomfortable and it's hard, but it will lead to better outcomes later. And when you are accepting something, you're not saying that it's okay that it's happening. You're saying, yes, this is awful. This is terrible. And now what am I going to do about it? I don't see a lot of people with persistent pain making that choice. I see them stuck in the rejecting. I reject that this is happening. I reject that this situation is here. I reject this pain. I don't want it. And that's very natural. It's very familiar. It's a pattern that they're already in. And so, in that way, in the short term, it feels better because it's familiar, right? Better the devil you know. But long term, when we are rejecting something that is true within us, we are suffering and we're denying ourselves the opportunity to improve or alleviate or rectify or change the situation or our perspective. So I'm going to give you this thought that besides the fact you can't reject your body because you're stuck with it, unless you choose to leave and commit suicide, which is fine. I don't have judgment around that. I would feel sad for sure. But it's a choice that people make. And ultimately, I think it's their choice. So if you're not ready to commit suicide, the choice to reject what's happening in your mind and body actually isn't even really available to you. So then people are stuck with tolerating what's happening. And tolerating what's happening is also a recipe for short term comfort in the way that better the devil you know, but long term, it creates havoc for people. I got all of this out of a relationship book actually between like partnership, significant other with another person. And I oftentimes apply that to the human body. And like you have a choice. You can accept your partner with them and all their flaws. You can reject their partner with them and all their flaws, or you can tolerate them. And I think tolerating a partner and all their flaws is a recipe for long term misery. And it's the same with your own body. Long term tolerating what's happening in you, it's it doesn't let you change anything. So then you just sort of stay with what is. And if you're in a position of suck, it's just going to continue to suck. What is this bringing up for all of you? I'm going to keep it shorter today because it's a holiday and I have a meeting with my co-author because we're writing a book together, which is very exciting. And that's happening here pretty soon. My meeting and the book launch. That's happening in April or May, and it's February right now. Hi, Jim. It's so good to see you. Welcome today. How are you? So, let me give you an example. Talk to me. Accept, reject, tolerate. I have a woman right now. I am working with a patient. She is a 32-year-old woman. She's had back pain for almost 20 years, since 13 years old. And she wants to reject it. Literally, her words, I want a total body replacement. But you can't do that. Good. I'm glad it's landing, Jen. Thank you. It landed too with this woman last week because she didn't realize, like, she was trying to reject something that ultimately she can't reject. There's no total body replacement store. You can't do that. That's just not available. I mean, you could get a fusion, but that's a 50% outcome for a $150,000 surgery. That's like saying, here's a $150,000 car with a 50% chance of working. Want to buy it? No, thanks. I'm not judging anybody who gets a fusion or don't. I really don't care. I'm just talking about my body. And the point is with this woman last week, that's not an option for her. She doesn't want to do that. And it's surgically not appropriate. So she's stuck with this back that's hurting. She's trying to reject it, but ultimately that's not an option unless you choose to terminate your life. Rejecting your body is not an option for you. So then you're left with the choice of, do I want to tolerate this or do I want to accept it? And if you tolerate what's happening, you're going to stay in the chemistry of the yucky, sucky stuff that you're in. And that will temporarily feel better because better the devil you know, right? So she's in this position where she's realizing I can't reject my back, but I've been tolerating it. And I'm tolerating the job that I'm in that is in part helping me and in part not helping me, right? There's physical stuff with her desk and how she has to reach and move in her back that's not helping, but the social aspect of having something to do and she likes her work, like it's a mixed bag. And she's tolerating this job and she's tolerating her back. And this woman is miserable. And so then what do you want to do? What choice do you want to make? Do you want to accept your job and your back for all that it is, a mixed bag of good and bad? and figure out how you can optimize or maximize what is to make things better? Or do you want to stay with what you're doing right now? And that was last week. She'll come back this week. We'll see what she decides. And maybe the decision is, I don't know yet. I got to keep thinking about it because this isn't easy stuff. But another woman that I work with who is a nurse practitioner and has persistent migraine headaches since a concussion several years ago, she ultimately was stuck in the suck of tolerating for quite a long time and then realized she had a choice, right? Like, okay, these migraine headaches may or may not be going away, but I can choose to stay miserable, locked up in a hole in my bedroom, or I can choose to go out and participate in life. So she's accepting the headaches are there and then doing something with it. The headaches are there. They are what is here. I can stay miserable by myself with them, or I can go out and essentially kind of force myself to participate in life, still have the headache, but now at least I'm engaging with people that I enjoy, doing activities that I love. And lo and behold, over time, that is helping her and it's reducing the power that the migraines have on her. So, those are two examples of somebody who is making a choice and somebody who's not making a choice, but she's going to make a choice, right? Like you can make a choice. There are things in life that we can't choose and we don't have any say over. We all experience pain and suck in life. There's no get out of suck free card, which is maybe the worst and best news ever. It's the worst because we'd all like to have it, but it's the best because it sets realistic expectations. So, concluding thoughts from anybody. I'm going to check in because I'm going to get onto this meeting with my co-author. Our book is called Getting My Happy Back. And I'm going to look up the subtitle for you because we just changed it and I love it. Oh, swing eighth. I'm going to come back to that in a second. That's a great question. Getting My Happy Back is the name of my book, and I'm really excited about it. I need to put this in a better place. You love that title, Jen. Thank you. Getting My Happy Back. Thank you all for your patience with me. Tell me, what are you taking away from today? What lessons, what insights, what ahas, what choice do you want to make with your body, with your mind, right? Like your body, it can be your best friend or your worst enemy or your greatest teacher and frenemy. And you're with it the whole time that you're here. I think might as well find a way to have a good relationship with your body because it's with you from start to finish. So make the choice to accept your body, however it's showing up, and you'll find a way out of suffering. That's my takeaway. Here's my book title, Getting My Happy Back. A guide to the truth we can't ignore when mind and body collide. That's nice, Jen. It makes me think of the peace, right? Like peace guides us to truth. And like, wouldn't it be nice to have a guide to the truth that you can't ignore when your mind and body collide? That's what we're attempting with this book. So, Jim, sometimes we forget that we can do something about our suffering. Yes, we absolutely can. Suffering will put horse blinders on us and make us think, because we've fallen into a trap, a pit of deep, dark despair, that there's nothing we can do. And it's learned helplessness. And I'm here to like champion the truth that if we can learn helplessness, we can unlearn helplessness. Oh, Jen, thank you for that encouragement. It's going to be a bestseller. I think so. because it's I just feel it's my 23 years and 45 almost years of life experience on this planet as an expert in the body and pretty savvy with the mind, for whatever that's worth. Like, we can champion these conflicts. Um, Margaret, you like the three-way choice. You can accept it, you can reject it, or you can tolerate it. And I think the key is when you accept something, it's going to suck for a little while because it's new and uncomfortable, but then it's going to get better. And it's the same with rejecting something. That's uncomfortable and it's going to suck for a little while, but then it's going to get better. When you choose to tolerate something, or you're stuck in a cycle of tolerating and you don't know, that is a recipe for long-term suck. And if you want to have a good relationship with your body, because you're in it from start to finish, that is your one choice to make. Do I want to accept this body, reject this body, or tolerate this body? And most of us aren't conscious of that. And so we can't really reject it. So we're stuck in tolerating it. And we're living these like sucky, mediocre, average lives. And that's understandable. And I think also tragic. Allison, great to see you. Oh, thank you, Owana. I'm looking forward to reading the book. It's really good. Like, we're writing it right now, and I'm just in awe with like, wow, life. It like when I choose to accept life, right? I accept my body. When I choose to accept life, because life includes uncomfortable and unknown and uncertain and things I don't like and things I don't want. But when I accept that and figure out ways to navigate it, I'm seeing more and more that life is actually on my side. And that flow is coming through this book. I find it beautiful. Jen, thanks for answering Margaret's question. I'm wanting to get back to something Angry Peach said in Swing Eighth. What lengths will the central and autonomic nervous system go to shut you down? Any and all is the answer to that question. And I don't think in certain scenarios that we can change or override that. Like, it's a reaction, it's a subcortical feedback loop, like a knee-jerk response, like, woo, I kick, I just do. But I think there's the moment after that we can then intervene. I remember one time I saw a motorcycle crash. I was the first car behind it, and I froze and I was totally ineffective. At the same time, I was being shut down consciously. My body had pulled over the car, called 911, and I was running to the scene of the accident. And the thing that woke me up from the shutdown was realizing that I was talking to the 911 operator, and she was asking me the same question like 6 times in a row. And I was really frustrated with her. I'm like, "Why are you asking me where I'm at? I told you, 8th and Wadsworth." She's like, "I understand, ma'am. Are you going northbound or southbound?" And something in me clicked back online. And I was like, "Oh, I just dissociated. Where's my feet? Where's my breath?" And then I was like, "Oh, I'm southbound." And then I came back online. So in extreme life threat, real or perceived, I don't think we have a choice. I think the central autonomic nervous system will take us out. But I think after that, we can intervene with our attention, awareness, and orientation to come back online again. So let me know if you have any other thoughts about that, Swing. Angry Peach, I'm too much of a warrior to accept negative things, but I find it easier to make changes when I'm in more of an accepting place. I like that. You are a warrior, and I really like that about you. And I don't think, God, that's such a good dilemma. You find it easier to make changes. That's a paradox right there. Like, you can make changes when you're in a place of accepting, which requires accepting that this negative thing I don't want is here. And I think that's the biggest key when we make the choice to accept our body or whatever it is. When I accept this body or this situation, I am not saying I have to like it. I'm not saying I have to want it. I'm not saying I agree with it. I'm saying that I'm willing to accept that this is what's true here. This is awful. This is bad. This is horrible. This is terrifying. And what is it that's for me to do now? And I think that's where you can really pull into your warrior energy. So, um, I've really enjoyed today. I appreciate all of your input. Um, Angry Peach, I have not talked about my relationship to coffee. My mind. I love it. I love the addiction. I love the adrenaline. My gut does not always enjoy coffee. This is just my personal experience. And my gut will really let me have it if I'm using coffee to push through something when I should be resting. I also know that if I drink coffee after a certain hour, I don't sleep well that night, which sets me up for a really hard, bad time the next day. So I tend to do decaf and sparingly. Jim and Jen, I like you guys being here. Um, Margaret, you said a few things. Um, a musician and extraordinary actor has a video called Hi, Ren. That's funny because my first three letters are Ren, R-E-N, Renee. I'll look this up. Margaret's giving us an invitation to look up a video with swearing and flashing lights, so it could be triggering. So just know that. Thank you for the suggestion and informed consent. Margaret, I will get that resource over to you. If this was helpful for you today, please like it, subscribe to the channel, and share it with other people. This is how we can make a shift in our world, is if we figure out what's ours to do, accept that giant, huge responsibility and privilege, and step into it fully. It's brave, it's vulnerable, it's difficult. I often don't want to do it, but it's very much worthwhile. I have really appreciated this time with all of you here today, and I wish you a good week. And I will be back next Monday. I've been doing consistent on Mondays at 10:30. I'm probably going to play around with different times. So subscribe and you'll get a notification when I'm live. And I look forward to seeing you all again, hopefully soon. Take care.